You're watching CTOM TV. Knowledge is power.
Okay, Amanda's wondering, does CBD oil help with cancer?
We don't really have a lot of information on that yet. There's been a lot of studies on CBDs in petri dishes and so on, and they didn't translate well to lab studies or preclinical studies. It was all just petri dishes, and most things kill cancer cells in a petri dish. One thing that CBD has been shown to do is to reduce seizures in epileptics. Not all epileptics, but certain cases, and it's had a remarkable response in certain children with seizures.
So on that note then, people who are perhaps, let's say glioblastoma patients.
Exactly. So with brain tumors, brain metastasis, but definitely glioblastoma or some sort of brain tumors. I would assume, it's been reported that it's an anti-inflammatory. I don't know how powerful it is of an anti-inflammatory, and I'm not really sure what tissues it accumulates in.
This is CBD?
CBD, yeah. But there's lots of claims. We just don't have a lot of data yet.
So it is interesting. It is kind of something like CBD oil is at that place where lots of people are using, especially we're in Canada, and in not the election that we just had, it's 2019, depending on when you're watching this. The previous election, one of the major platforms of our prime minister was a legalization of marijuana, which has happened. And so there's a lot more ease of access to THC and CBD for a variety of different concerns. So we're getting a lot more kind of anecdotal evidence of people talking about their own personal experiences, but the clinical trial is still, we're still not sure.
No, we're not sure
what factor. But there's not, in the literature that I've perused anyway, there aren't any side effects to CBD that could be detrimental.
All CBD is going to contain some other cannabinoids. Like THC. There's always going to be a bit of THC in there.
How is that a bad thing?
Well, people have been denied jobs and insurance coverage based on testing positive.
Oh, okay. So sure, there are, yes, absolutely. Consider the scenario of your life. What I mean is
you can get an impaired, you
physically.
can get a roadside
Well, what about from a
driving.
human being physiological perspective? What kind of side effects might there be to them?
We don't know.
We don't know. We're still wondering about this after all this time. Okay. All right. So Amanda, I guess the answer to your question is with seizures, it seems to have a positive
There's no
effect.
activity actually in cancer. So we know of.
Right. And that what you said earlier about the petri dish thing, I think would be valuable to just expand on a little bit more, because we hear there's so much stuff out there about how, this took care of this in the lab, and it's important, just like we see, in mice studies, this happened. It's important for people to understand that doesn't automatically translate to the physical body.
No, it doesn't. We have an immune system. We have a metabolic system. We have a microbiota. There's many factors there that can dictate whether something works or not.
Yeah, that aren't present in the petri dish.
Exactly. Petri dish
So
is just agar.
So it's important to keep that in mind, that if you see this study that, in a lab, scientists were able to kill all the cancer cells, that really doesn't mean anything about what it's going to actually do in your body.
We don't really look at that sort of study.
No, your doctor
we don't even look at animal
either.
studies. We look at human studies. I mean, even in, for example, the use of lab rats and mice. I mean, these are heavily genetically altered creatures. And, for example, mice only require 3 altered signaling pathways to develop cancers because they have an active telomerase gene, whereas humans require 4.
Right.
So they're not even a great model for cancer.
They're kind of, yes, that's right. I guess they are a little bit more politically correct than a dog or a cat or a pig or something.
Yes,
I don't know.
Most definitely.
Although I feel for the mice.
Me too.
But yeah, okay.
Thank you for watching CTOM TV. Subscribe below and stay informed.